Good evening, I'm Matthew Dodero, and I'm here to talk to you a little bit about breast cancer and the need for health advocacy for this disease. So I want to start by talking about the anatomy of the breasts. So breasts are made up of lobules, or milk-producing glands, and ducts that carry the milk to the nipples, and they're surrounded by fatty tissue that give breasts their size and their shape. Within the breasts are lymph vessels, which are connected to the lymph nodes underneath the arms. So now that we know a little bit about the anatomy of the breast, it's important to note that there are two types of breast cancer. There's non-invasive cancer, which is when the cancer cells are inside the milk ducts but have not yet developed the ability to spread throughout the body. But then the most common type of breast cancer is invasive cancer, when the cancer cells have actually developed the ability to spread throughout the breast or throughout the body. There's also lobular breast cancer, which is the second most common type of breast cancer, where cancer cells in the lobules have spread into the surrounding breast tissue. Additionally, there's inflammatory breast cancer, which is rare but fast growing, where the skin of the breast looks red and almost inflamed, which is caused by the breast cancer cells blocking the tiny lymph channels in the breast and the surrounding skin. The last type of cancer that I want to point out here is an uncommon type of breast cancer called Paget's disease that causes the skin of the nipple to actually change in appearance, similar to eczema. So now that we know a little bit about the types of breast cancer that one can develop, it's important to talk about some of the risk factors associated with disease. So the age plays a big role with this. The older a person is, the more likely they are to develop this disease. But the most important factor to take into consideration is gender. Women are actually 100 times more likely to develop breast cancer than men. Weight actually plays a big role with this as well. Gaining weight in adulthood appears to increase the likelihood one will develop breast cancer. Breast density also plays a role with determining who will or could possibly develop breast cancer. And breast density is a measure used to describe the proportion of the different tissues that make up a woman's breasts, and it compares the area of breast and connective tissue seen on the different scans or mammograms. So women with breast density that is high are 4 to 5 times more likely to develop breast cancer than those with a low breast density. And then we want to talk about childbirth and breastfeeding, which both have a positive effect on the likelihood of one developing breast cancer. Women who give birth to their first child before the age of 35 or have multiple children, give birth to multiple children, actually have a decreased chance for developing breast cancer. Additionally, breastfeeding lowers the risk of breast cancer, whereas menopause or going through menopause past the age of 55 actually increases the likelihood that one will develop breast cancer. So now let's talk about some of the things that we can affect and change in our life, the different lifestyle choices that we make. So exercising will actually decrease the likelihood by 10 to 20% for one's likelihood to develop breast cancer. Eating vegetables and fruits will actually help lower the risk of breast cancer. Women with a higher blood level of the natural orange and red pigments found in foods called carotenoids have a reduced risk of breast cancer, compared to those with lower levels. And these carotenoids can be found in foods such as melons, carrots, potatoes, squash, those reds and orange types of pigments that you want to look for. Another thing that we need to think about is the consumption of alcohol. Drinking alcohol actually increases the likelihood that one will develop breast cancer. For example, a woman who drinks 2 to 3 alcoholic beverages a day has about 20% more likelihood to develop breast cancer than those who don't consume any alcohol at all. So knowing the different risk factors and lifestyle choices that we have that can affect breast cancer, let's talk a little bit about some of the statistics. So it's estimated that 268,600 new cases of invasive breast cancer will be diagnosed in 2019 in America, and 2,600 new cases of invasive breast cancer in men in 2019 in America. So again, as we talked about earlier, this disease affects women greatly more than men in a 99-to-1 ratio. So with this high number of cases of breast cancer, let's talk a little bit about some of the treatments available. Surgery is the first treatment for most people with breast cancer. There's also chemotherapy, which is a treatment that uses anti-cancer drugs to destroy the cancer cells. There's radiation therapy or radiotherapy. That's a treatment for cancer that uses carefully measured and controlled high-energy X-rays. And then there's hormone therapy. So some breasts are stimulated by the hormone called estrogen. And this type of breast cancer is called estrogen receptor positive. So hormone therapy or endocrine therapy is a treatment that blocks the effect of estrogen on the breast cancer cells. Another treatment for breast cancer is targeted therapy or biological therapy. And this targeted therapy is a group of drugs that blocks the growth and spread of cancer. They target and interfere with the processes in the cells that help cancer to grow. So with all these treatments, you would hope to see a low mortality rate, but actually it's estimated that 15% of those diagnosed with breast cancer in 2019 will actually perish from this disease, with an estimated 42,260 deaths in the US alone. So breast cancer mortality has only decreased by 39% from the year 1989 to 2015. So talking about this high mortality rate just goes to show that we have a very high need for advocacy for this disease. 31% of those with no health insurance had a mammogram in the past 2 years. And even with those who do have health insurance, it's only estimated that 68% of them had a mammogram in the last 2 years. So what are some of these barriers stopping people from having these screenings, having these mammograms? Some of it's low income or worry about the cost that they might have to deal with. Some of it's access to care, whether that be transportation issues or not having a screening center nearby. Sometimes they don't have a primary care physician, or if they do, the primary care physician isn't recommending having a mammogram. So there's all kinds of things that can truly affect one's likelihood to even realize that they have this disease and catch it early on. Again, we also have to think about the low education levels that occur within our communities at times, which leads to a lack of knowledge about the disease, or sometimes even fear about what it would mean if they were diagnosed with disease, or the pain or associated with the procedures that might have to come. Additionally, we have to think about the literacy levels in our country. It's estimated that 30 million Americans read at or below a basic literacy level from 2018, which is 10% of the population. And then coming to a local level, 20% of adults in Central Florida read at or below a 5th grade level. So we've got all this type of technology and materials out there educating the public, but if they're not able to comprehend this, we really need to talk about that. So it brings us to community resources. We need to have more mobile mammography buses, so for those that can't find transportation or a close screening center, they have a way to still have this service provided to them. Community education, again, with a low literacy level, we want to educate the community in different ways to make sure that they understand what can affect the likelihood that they develop it, what they can do themselves to decrease their likelihood of being diagnosed with breast cancer. We need to think about the local foundations and support groups for those that do have breast cancer or know someone affected by this disease. And again, talk about the local health departments. Thankfully, we do have the American Cancer Society, which can actually provide transportation for some patients who can't find transportation to having a mammography. So the different media or different types of outlets that we want to spread this information to the public. We want to think about pamphlets, but again, if we've got these pamphlets and they're not able to comprehend what the information that we're trying to provide to them, we have to find some other avenue. So radio advertisements or billboards, bus wraps, social media ads to target the entire community and the different ways that people interpret and come upon this information. So in conclusion, I want to talk about what we've talked about here today. So it's estimated that over 271,000 Americans will be newly diagnosed with breast cancer in 2019. Some of these barriers again, low income, lack of access to the mammography services, lack of a PCP or lack of being referred to have a mammogram, lack of education levels that can hinder someone from having the knowledge about the disease or just fear itself. Again, we talked about some of the resources from pamphlets, radio advertisements, bus wraps, community education, local foundations, support groups, everything out there trying to educate the community more and provide services so that way if they know someone who is diagnosed or they themselves are diagnosed with breast cancer, they've got some place to turn to. So by increasing the resources and increasing funds available for these resources, some of the possible outcomes that I would hope to see an increased awareness of the seriousness of this disease, and that's through people having the mammograms, that's through having more conversations amongst themselves and amongst community groups to just spread that awareness for screenings. An increased number of having mammographies take place each year with ultimately a hopeful decrease in the mortality rate from this disease. So the actions that I would really implore you to take after hearing this presentation, we must speak with our community, get the education out there to them, provide education for those with a wide range of literacy levels. We must pull together funds to improve our resources available to the public. We must engage the local leaders to push for an increase in focus on the literacy levels, so when we do get these resources out there, people are able to comprehend them. And then ultimately, I leave you with one question. What are you going to do? What is your one step that you're going to walk away with today to increase the awareness for breast cancer and decrease the mortality rate in America? Thank you.